home. We're proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. I'm very excited to welcome our speaker today for Grand Round, Dr. Raul Gutierrez. Dr. Gutierrez is a national voice in advancing health equity and serves as chair of the AAP, American Academy of Pediatrics Council on Immigrant, Child, and Family Health. Locally, he directs the Bridges curriculum at ZSFG for recently immigrated children and the Pediatric Asylum Clinic with the UCSF Human Rights Initiative. He also directs our PLUS residency program, which emphasizes community partnerships to help vulnerable populations. Drawing on his extensive work in clinical care, advocacy, and guideline development, Dr. Gutierrez will share insights into how immigrant status influences health outcomes and explore approaches to mitigate harm within health system and clinical settings. And I believe this topic is very timely for us, given where we are right now in our country's politics. And so, Raul, welcome.
Thank you so much, everyone, for inviting me and having me here. As we know, this is very timely with the inauguration of the president in the executive orders that have been issued this week, and we will talk a little bit more about that as well. I have no disclosures for today. However, I do want to acknowledge that although I grew up in an immigrant family, I am not an immigrant myself. And so I stand here doing this work and presenting with humility and respect for the lived experiences of my family, my patients, and my colleagues whose lives are affected by immigration policy on a daily basis. So today we're going to do a couple of things. It's going to be a lot of information. It's going to be good information. I hope everyone learns something and can take something away with them to their clinical environments in being able to advance immigrant health as a partner with me and all the other people who do this. But we are going to talk about immigration status as a social and political driver of health, describe the health effects of exclusionary immigration policy, and explore approaches to mitigate harms within health systems and the clinical setting. I wanted to reflect that I did this first talk on immigrant health back in 2019, which feels such a long time ago, and so many things have changed since then. But at that time, there was a lot more interest in the topic of immigrant health, particularly within pediatrics, for multiple reasons. But that administration also had many different policies that we had our eye on and that pediatricians were very key in working against, including things like zero tolerance and family separation at the border, the Remain in Mexico policy, targeted deportations, and so on and so forth. And at that time, we had seen a flip in the demographics of people coming through the southern border. And in fiscal year 2019, for the very first time, families and unaccompanied children outnumbered adults at that time. And so this was really a red flag for everyone to really understand what is going on with immigration policy, what are we doing at the border, and what does that mean for the health of children in particular, as this system was not built to care for children, nor was it built in a humanitarian way to be able to support those in most need. And as I go through this talk, I'm hoping that everyone can reflect a little bit on their experience since then. What is your experience with children in immigrant families? What barriers, challenges, or concerns do you and the families you care for face as we move into this next administration? So think about that, whether you're primary care, specialty care, hospital medicine, intensivist, social workers, nurses, anything. Your patients that you have are children in immigrant families. So think about that as we go along. So I want to talk a little bit about patterns and how they've changed over time. In general, we've had a huge influx of immigration along the southern border. Here we see fiscal years 2022, 2023, 2024, and 2025 to date. And you can see here that the encounters on the southern border in 2023 reached up to over 3 million encounters. That came down in 2024, and we have a dramatic increase going into 2025, which will likely continue to decrease. And there are a couple of reasons why we see that decline. One is increased enforcement in Mexico, and we will see how that will change with the new president in Mexico. A higher bar to prove harm will occur if repatriated to one's country, and a shut-off of the asylum for the majority arriving at the border once the average number of encounters reaches 2,500 per day. And that was under the Biden administration. At this point, nobody is really coming through under the new administration, and I'll talk a little bit about that in a second. I also wanted to talk a little bit about demographics. While the majority of folks are single adults, again, we still have a significant number of family units, as well as unaccompanied children. So that has not changed, and I don't think that we foresee that demographic changing anytime in the near future. And when people arrive here, we have different perceptions of who an immigrant is. And I want to just point out that there are all different types of statuses that people can have. And no one idea of what you think an immigrant person is necessarily you can ascribe to everyone who's an immigrant. General categories are naturalized citizen, or somebody who now has the benefits and responsibilities of citizenship, a permanent resident, a refugee or an asylee. Those are people who are forced to flee due to persecution, with refugees coming from being accepted into the United States internationally, and asylees are those who are already in the United States. There's this kind of umbrella category of twilight status, which has many categories, including folks with DACA, TPS, or temporary protected status, or humanitarian parole, and then a whole group of folks that we will call unauthorized or here unlawfully in the United States. About a quarter of people are unauthorized. The vast majority of people are here with some form of lawful status, whether naturalized permanent status or some other temporary status. And in California, more specifically, California has more immigrants than any other state. About 27% of California's population was foreign-born. The national average is about 12%. And foreign-born residents represent at least 1/3 of the population in Santa Clara, San Mateo, Los Angeles, San Francisco, and Alameda. And half of California children have at least one immigrant parent. Now, the vast number of children in immigrant families are citizens themselves, but half of California's children have at least one immigrant parent, okay? So when we're talking about immigration policy, we're talking about a lot of people that could potentially be affected, and all those folks walk through our clinics and our hospitals. I'm just gonna put this out here as a framework, really just kind of thinking about the influence of anti-immigration policy on health status, with lawmaking over on the left, particularly anti-immigration laws, so restricting rights, granting minimum rights, granting more than minimum rights, depending on what the law is, which then goes into legal practice or enforcement, which informs changes in one's environment as well as changes in one's behavior. And then downstream, we see impacts on access to health service, as well as health outcomes. So a lot of the stuff that we're seeing in our clinics is really downstream. And so we really need to think a little bit more upstream in terms of being able to mitigate any of these potential harms. And migration cuts across other social determinants of health. From a socioecological model, we can see this at the individual level, at the community level, in one's living and working conditions, as well as just general socioeconomic, cultural, and environmental conditions. I know this is really busy. I'm hoping that slides will be shared and you can kind of dive into this a little bit more. But all this to say is that immigration and immigration status in and of itself is a social and political driver of health, and also affects other social and political drivers of health. One way that we can see this is families' access to key federal means-tested programs. And here I've outlined refugees, asylees, and victims of trafficking who tend to be eligible for most of these means-tested programs, while we look at undocumented immigrants, and depending on which state you are and what program you're looking at, are more likely to be ineligible for these types of programs. And when we look at all the other statuses, it really depends on the state that you're in. So we're fortunate to be in California and have universal access to Medi-Cal, but other states, other people living in other states are not as fortunate. We can also see this in healthcare access. Looking at the left, we see the use of healthcare among adult immigrants in 2023. And we are comparing naturalized citizens to lawfully present immigrants to likely undocumented immigrants. And we see that there's a disparity here in terms of one's usual source of care, other than the emergency room, no doctor visit in the past 12 months, or skipped or postponed care in the past 12 months, with folks who are most likely undocumented having higher rates of all those things. And when you look at uninsured rates among children, we see that overall uninsured rates are low, but we still see a discrepancy here with non-citizen children having uninsured rates of up to 25%. And looking at California specifically, we look at uninsured rates from 0 to 64. We certainly see some disparities among the Latina population at 12%, but overwhelmingly undocumented residents are uninsured at a rate of 27%. And I also want to point out that this administration's policies is not new. In the past 2 administrations and even before that, there have been hundreds of policies that are anti-immigration that are not very welcoming. You can see this from the Immigration Legal Resource Center, and they've categorized all these policies into preventing entry, denying status, taking away status, destroying due process, detaining, deporting, and terrorizing, and retaliation. And so what's next? And I used this slide back in 2019, and I'm bringing it back for now. And while there's a lot of policies going out, there's a lot of confusion about what's going to happen, about how it's going to be enforced. But more than anything, what all this is causing is fear. And that's important to take into account. So we knew that on day 1, some of these things would go into effect. Mass deportation, reinstating of family separation and family detention, conditions in Border Patrol custody, and the use of open air sites to detain people, new policy on immigration enforcement in sensitive locations. Some of these might start to sound familiar. Loss of protections for unaccompanied children, rescinding and reissuing public charge rules, dismantling the DACA and ACA for DACA, and overturning of Pyler versus Doe. Pyler versus Doe is a Supreme Court case that essentially protected children's access to education, regardless of immigration status. If there's one thing that every person, every child in the United States can have, it's an education. But that might be up for grabs as well. And so we knew that some of these things would go forward on day 1. And so let's just dive into what we're seeing. So one of the executive orders was declaration of a national emergency at the Mexican border, essentially reinstating the Remain in Mexico policy for asylum seekers at the US-Mexican border. This means that there's a cancellation of a program called CBP-1. This was an app that people could use to make their claim and register for an appointment to be able to claim asylum. CBP-1 has been shut down. And so anybody who is ready for an appointment or who had an appointment has at this point been canceled. And instead, people will be remaining in Mexico until they have their appointment to come into the United States and make their claim. With this, we potentially will see more refugee camps in Mexico and have another increase in a humanitarian emergency on that end. We also might see, we'll see increasing militarization at the border. And that comes with some implications. We know that the militarization in the border is not helpful for children and families. And we've seen time and time again that it puts children at risk for illness as well as death. There are many advocates within the American Academy of Pediatrics who are working against this and trying to advocate for safer and more comprehensive protections and care for children and their families along the southern border. But we'll have to keep our eye on this to see what happens as enforcement increases. We also might see an increase in detention, both at the border and internally. There was a study done by over at Harvard by the Center for Health and Human Rights, as well as the MGH Asylum Clinic at the Center for Global Health. And what they saw was that children detained for a prolonged period in family immigration detention centers, when those were open, are experiencing mental and physical harm due to inadequate and inappropriate medical care. They looked at medical records of 165 children in family detention from 2018 to 2020 and found that kids are being detained for a median duration of 43 days. The maximum should be 20. They had limited access to basic health care, inadequate staffing, supervision, and documentation of medical care, and inappropriate screening and follow-up care for chronic medical conditions, malnutrition, tuberculosis, and mental health. We also have seen repeatedly reports of separation from families, sleep deprivation, sexual assault, medical neglect, overcrowding, and so on and so forth in these types of detention settings. There was also a suspension of the US refugee admissions program. The Homeland Security is to report back within 90 days whether resuming refugee entries would be in the interest of America. So approximately 10,000 refugees had travel booked, which is now canceled. Folks are coming from all different parts of the country. And at this point, all refugee care processing and pre-departure activities have been suspended. We don't know what this means for the refugee program going forward. We do know then the first go of this administration that the number of people entering the United States did go down significantly, which could put families and children at risk wherever they are waiting for placement and delay reunification with family members who might be here in the United States as well. There was also an executive order ending birthright citizenship. I'm not going to say too much about this other than to say that this is not something that's going to immediately go into effect. It's protected by the 14th Amendment, and the attorney generals of 22 states have already sued, including the cities of San Francisco and Washington, D.C. However, it is having some effect. This is from the New York Times, where we saw Ms. Torres, an immigrant from Colombia, who said she was relieved that her scheduled cesarean section had moved up to before President Trump took office. It wouldn't surprise me if people who are pregnant are going to be going to their OBs and asking to be induced before anything goes into effect. And then mass deportation. Most of this is causing confusion about the scale, feasibility, and the legal basis for these types of mass deportation. And it's really just creating a lot of anxiety and a lot more fear. Additionally, this administration has revoked the 2011 policy that restricted ICE enforcement at sensitive locations. Sensitive locations included schools, as well as colleges and universities, hospitals, institutions of worship, sites of funeral, wedding, or other public religious ceremonies, as well as during the occurrence of a public demonstration, such as a march, rally, or a parade. So this puts ICE enforcement squarely in our lane as a sensitive location. And that's something that we need to consider. I put this up here that Trump has limited power to remove some of these more protected groups. However, for example, with temporary protected status, the Biden administration extended that protection, but the Trump administration could let those things expire over time. So there's a lot to wait for, and there's a lot more to come. And then I just want to add a couple of other things going on in the other branches of the government. Within the court, and within the courts or the judiciary system, there was a federal appeals court that declared deferred action for children arrivals, or DACA, unlawful. That creates a lot of uncertainty for over 500,000 unauthorized immigrants who were brought to the US as children. For the moment, DACA continues to be alive for current recipients and they can renew, but it's closed to new applications. This is likely headed to the Supreme Court. And in Congress, we had the Laken-Riley Act. This allows the Department of Homeland Security that runs Border Patrol and ICE to detain undocumented immigrants who have been charged with theft-related offenses, so burglary, larceny, and shoplifting, in addition to others. And it also empowers attorney state generals to sue the federal government if they believe immigration laws are not being adequately enforced, which puts much more power into the state in terms of immigration policy. This passed the House, the Senate, and was signed by the president yesterday. A lot of advocates feel that this may lead to racial profiling, undermining of due process, and result in the detention of individuals who don't actually pose a public safety threat. All right, what does this all mean? What do we care? Many of our colleagues have done a lot of research around what this means for health and healthcare access. And there are clinical implications to immigration policy, including mental health issues among kids, including increase of anxiety and symptoms of PTSD. It leads to poor health outcomes, including increased risk of low birth weight or premature birth weight, and increased risk of cardiovascular disease. Family instability in the forms of separation, and short and long-term threats that threaten safety, economic security, and overall well-being. Additionally, we know that fear of deportation makes communities less healthy. People are afraid to drive and access public services, including medical services, afraid to use parks and exercise outside, miss medical appointments, and afraid to get involved in their communities in general. And there is a chilling effect that we learned about in the first go of this administration. In 2019, 25% of low-income adults in California reported avoiding public programs out of fear that participating would negatively impact their immigration status or that of a family member. And this was related to the public charge. The share of children receiving benefits fell about twice as fast among US citizen children with non-citizen household members as it did among children with only US citizens in their household. And the participation in SNAP among children in mixed status households dropped about almost a quarter, 5 times that of US children in citizen-only households. We also saw a decrease in well child visits. This was a study that looked at scheduled adherence, hospitalizations, and ED visits among children less than 4 of immigrants versus US-born mothers in 3 US cities. There was a decrease in well child visit adherence for children in immigrant versus US-born mothers, and likely missed opportunities for things like vaccinations, health and development screenings, and so forth. We also saw ED visits at the general potentially decrease. This was a study done by Dr. Rodriguez, who is a faculty in the emergency department. And they saw that 75% of undocumented Latino and 51% of legal Latino residents reported that the anti-immigration rhetoric in 2016 made them feel unsafe living in the US. A majority thought that the changes had already taken place. Undocumented Latinos were also more likely to report that these statements made them afraid to come to the ED. And for those who did report being afraid, about 55% stated that it caused them to delay coming into the emergency department. We also see that there's collateral damage. This was a study in 2019 looking at the perceived vulnerability with mental and physical health among US-born Latino adolescents in California who had a relative who was an immigrant. In general, that they saw there was an increase of anxiety, hypervigilance, high blood pressure, and poor sleep as well. The other thing that I worry about, particularly with schools being on the list of safe zones that might be a target, is whether kids are going to be going to school. And whether our young people, particularly those who are undocumented, will start moving towards work instead of school. And we do know that even currently that there is a particular amount of exploitation, of labor exploitation among youth, where kids are working long hours or overnight shifts, have harmful conditions around them, are subject to human trafficking or forced labor, and are also open to exploitative recruitment practices. And so it's something to look out for, particularly those working with young people. All right, we're going to shift gears. what are we going to do about all of this? So at the moment, and for a long time, we tend to veer towards this vicious cycle in terms of policy. Poor integration, exclusion, alienation. And what we really want to do is kind of move to this more virtuous cycle of social cohesion, effective integration, sense of belonging, and inclusion. And at the moment, it might feel like, what can I do about this? This is so big. These are big players. What do I do as a healthcare professional to help move us towards this virtuous cycle? And the one thing that I will say is, one of the people who are most trusted, it is pediatricians, right? So we can use our voice. We can talk about what's going on, and we'll talk about that in a little bit. Two, we do have some influence and power in the environments in which we work in. Hospitals, our clinics, in our own patient rooms, clinical rooms. And there is work that we can do there as well. So some of the things that I hope to be able, that you will walk out with, is how to prepare, how to protect, and how to inform. And so we're going to dive into that now. So trauma-informed care is critical. These are factors related to migration that affect mental health. These are organized in pre-migration, migration, and post-migration. In particular, right now, we really want to focus on the post-migration aspects, right? Uncertainty about immigration or refugee status, stress related to family separation or adaptation, and those types of things. Yeah, these are things that are going to walk into your clinic. People will be concerned, people will have fear. Some kids will have both mental health and somatic symptoms related to these anxieties and these fears. And we need to talk about that in a very trauma-informed way, in a way that practice cultural humility and understanding of people's lives as immigrants in this country at this moment. We certainly we already know that we're in a mental health crisis for kids, and the lack of mental health practitioners as well as language access is paramount. And we do need to think a little bit more about how we can provide some level of support from the mental health angle in thinking about innovative ways to be able to do this. You're partnering with our community-based organizations, looking at different models such as groups and instead of individualized treatment, not waiting until we have crisis and trying to implement these things before we get to that level. Additionally, there's a lot of information out there to help us better understand the populations that we're serving. This, for example, is caring for former unaccompanied immigrant minors or children. That goes into some deeper information as well as recommendations on how to approach these particular populations. There's also the idea of sanctuary doctoring, being able to open up conversation about people's potential fears around what is happening politically. So opening dialogue that places patients' fears in context and generalizing any challenges. Many of my patients are currently experiencing anxiety about immigration problems. Is this something that's affecting your family? Do we want to talk about it? Can I provide you with support or somebody who can talk to you more about this, or resources, things like that. Providing welcoming spaces. For those who particularly have children in immigrant families, it's important to reflect those populations in our clinical settings, whether that be a button, whether that be a poster, whether that be free access to information that is available to them, or being able to have things in different languages. That needs to be visible, and that is very welcoming for folks to be able to do that. Again, we have to worry about ICE enforcement in our clinical settings. This is promoting safe and secure healthcare access for all, and this is guidance for California's healthcare facilities that was put out by the Attorney General in California. And it provides general guidance for all different types of clinical settings to be able to think about what kind of policies they want to implement. I do want to point out that UC Health does have policy around this. They actually put it together back in 2019, I believe, and they just reissued it in December of 2023. And I do want to thank my colleagues over at Benioff Children's Hospitals because they were instrumental in pushing our administration here at UCSF to think about what our policies and procedures look like. There was a mock ICE enforcement that was done here at Mission Bay Hospital. I'm hoping that we can pick that up again and do it at both of the children's hospitals as well as all the other affiliated hospitals with UCSF health system. So for those who have that type of power and influence, let's remind our administrators that we need to get on this. There are similar policies and procedures for those who work with San Francisco Department of Public Health over at San Francisco General and all their affiliated clinics and hospitals. And the one thing that I will say is that not only do we need to look at that policy and recognize it, but we also have to move a step forward and understand, what does that mean for my clinical setting? What does that mean for my department? What does that mean for my division? What does it mean for each particular clinic? Thank you to Eleanor Chung over at the Children's Health Center at San Francisco General, who put this policy and procedures together for us in our clinic specifically. And we're really trying to target and understand, like, whose job is this? When something comes up here, somebody comes to me asking to see if they can talk to a patient and they are an ICE agent, who do I go to? Who's the person that I talk to? Where do I direct these people? And then where do they talk? And then how do they kind of go up the chain of command? So having these things and practicing them and understanding them is really going to help everyone prepare for this and hopefully mitigate some of this fear. Language justice. We need to be able to communicate with folks in their preferred language. This doesn't only mean using interpreters. That is a great start. But it also means signage. It also means handouts that we're putting out there. We need to be innovative, particularly around languages where it's not written, particularly indigenous languages that are Mayan, and think about, how do we do video recordings? How do we provide this information in a way that is helpful to families and so that they understand the importance of having to come back, particularly if they are afraid to come into the hospital. Family preparedness. Many of our immigration justice colleagues are already doing this work on the ground. That is their expertise. That is what they do. That doesn't mean that we can also offer this information in our clinical settings. So offering things like Know Your Rights cards, which you can order from the Immigration Legal Resource Center, and there's a QR code for that, but really understanding and helping our advocates share numbers like the Rapid Response Network if they're ever in trouble. This also can mean working with our families to create a family preparedness plan. If you can imagine, right, for particular patients who have special healthcare needs, having their family member who is at risk of deportation leave that family and lose the pillar of their access to healthcare is going to be super important and crucial to maintain. So working with families to do a family preparedness plan could be really instrumental in being able to make sure that they have all their important documents in order, including healthcare documents, making sure that they've designated a person to be able to take care and make medical decisions for a person if that parent or guardian is deported, could be really important. I'm going to gloss over medical care a little bit here, but only to say that people who are coming from other countries into the United States have suffered all different types of trauma. That includes structural and economic inequality, violence, and disasters and climate change, which we will see more of in the future. And many have burdened a very arduous journey here. That exposes them to many things that affects health and safety. So remember to think about these other health considerations when you're interacting with immigrant children and their families. Thinking a little bit more broadly about infectious disease, malnutrition, toxic and environmental exposures, violence and injuries, mental health, and other types of health concerns, such as undiagnosed or poorly controlled chronic conditions. Particularly for those in primary care, There's a lot of guidance that's put out by the American Academy of Pediatrics. Here is an example of what that guidance could look like. We use this regularly at the Children's Health Center over at San Francisco General, and many of our community clinics also use this guidance. So that's there for you to be able to use to kind of buff up on that. I also want to celebrate the expansion of Medi-Cal in California. In January of 2024, Medi-Cal was expanded to ages 26 to 49. So we kind of filled that donut. I want to celebrate that. It's important for kids, parents, and guardians to also be healthy and have access to Medi-Cal. And this opened up to 700,000 adults in the state of California, which is huge. And we don't want to roll this back, right? We don't want to lose momentum here.
That includes undocumented folks.
That includes undocumented folks, yes. So provide awareness. So in 2023, about a quarter of likely undocumented immigrants and nearly 1 in 10 lawfully present immigrants say that they avoided applying to food, housing, or healthcare assistance due to immigration-related fears. That's in 2023 under the Biden administration. Yeah, nearly 3/4 of immigrant adults, including 9 in 10 of those who are likely undocumented, report uncertainty about how programs may impact immigration status. These things are only going to get worse. So we really need to work with our social workers, our eligibility workers as a team to be able to continue to encourage folks to be in these programs and not disenroll from them. And then the last thing I wanted to do here is talk about medical legal partnerships. These are vital and super important. And there are different ways that we can work with our lawyers to be able to support families. One of those is writing letters of support. So attestation of special needs or attestation that a child or caregiver must remain together based on the child's healthcare needs. If you go to this QR code, there's some examples of what those letters could look like, and you can create a template for yourself. I also want to shout out the Health and Human Rights Initiative, where we do psychological and medical forensic evaluations. If there's something that you want to do, we can help you learn this skill. And you can provide these forensic evaluations for people who are applying for asylum. 89% of people who have a forensic evaluation are granted asylum compared to 38% without this evaluation. So this can be particularly impactful. There's a QR code there for you to look at. And if you're interested, feel free to contact me and we'll see if we can fold you in to doing these evaluations as well. Doesn't matter, general practitioners, specialists, you will get all the training, you will practice, and you'll be able to do them. Do a deep dive. This is a website called Everyone Belongs Here. This is a website that was launched back in 2017 alongside Dr. Jyoti Marbin and a bunch of other pediatricians in family practice and residents and medical students. We really wanted to provide a clearinghouse and really provide information for folks to be able to learn how to mitigate some of these harms as it relates to medical care. So we've just relaunched this this past week. It's redone, it's much prettier, it's much more comprehensive. We're getting community-based organizations to look at it and vet the information that's on there as contributors so that people can use this information to help them. Also remember that the American Academy of Pediatrics has policy that helps advocate against detention of immigrant children, providing care for children and immigrant families, and we have a bunch of other policy statements that are on the way, including one to be able to advocate for children who are being received at the border. This is available to you. It's free access. These are things that you can use in your advocacy, that you can cite for any advocacy moving forward. And I put this in here. If you're in the middle of the room the whole time, why can we not find a single witness to corroborate your testimony? And I put this up here because I don't think that we always feel empowered to share the stories of how our patients are impacted. So I want to encourage us to do some storytelling. This was from a listserv that I'm on. and this was a pediatric nephrologist, saying families have been requesting written documentation to show ICE about the medical complexity of their children when the parents are undocumented. Similar to any chronic disease, it would be devastating and detrimental for the child's care, and the main caregiver were to be removed, and they were the ones participating or primarily bringing them for dialysis transplant needs. So this is already out there. These fears are already out there. Families are already asking for help. People are worried. And so I think it's important to really listen to that. Even if it's just one person, it's one of many, and all of us are hearing this. So share these stories with each other. Talk about it. Talk about it to your administrators. What should we do here? How do we change this? How do we answer these questions that our families are coming to us with? And here is just some information on advocacy storytelling. But your story, write an op-ed, share it in your grand rounds, talk about these things. If you need more information on how to do this, there are AAP resources on the AAP advocacy guide that talks to you a little bit more about just kind of the art of storytelling and how we can use that as pediatricians to kind of make our case. I also want to say support one another, particularly our international and undocumented learners, staff, and faculty. These are folks who also might not be willing to share their story or be vulnerable. Just know that they're with us here as well. International learners may be directed to the International Students and Scholars Office for more guidance. And in general, if you are approached by ICE or Homeland Security and asked about specific students, employees, or faculty, tell them that you need to first contact the Office of Legal Affairs, and there's a phone number that you can talk about. But again, this is something like, where do I put this number? Who do I go to? So make sure you practice this. Make sure you have people in your office, in your clinical setting, who know these things and know how to do this, right? So it just doesn't lie on every individual. And what can you do in your practice? This is just a QR code. Action changes things. It's just a survey for you. And it goes through some other resources. And it just asks you, what do you want to do? So feel free to scan this. And if you want to jot down some ideas for yourself, complete the survey. It'll go back to you in your email. And then you can follow up on it. Talk about this at a staff meeting. Order some Know Your Rights cards and put them out in your clinic. Make a template for the specialists out there. Make a template on a support letter for your families about your patient's condition. Any of those types of things. So feel free to do that. Think about what you might want to do, and then follow up on it and do it. And I think I'm going to finish there to give time for questions. And I just want to give a big, huge appreciation to people at the Center of Excellence for Immigrant Child and Health and Wellbeing, the Health and Human Rights Initiative, the Latinx Center of Excellence, 6M Bridges Clinic, and all the people who are doing this work at the moment. We have a long 4 years, but if we all do it together, I think we can accomplish a lot and mitigate a lot of harm that we know is coming. Thank you.
Thank you. I just want to start with a comment on the Zoom, which I completely agree with. Dr. Elizabeth Oster said, thank you for your excellent, really helpful presentation, and I really appreciate. I was thinking, oh, yeah, I don't care what I'm going to do, and I'm like, oh, there are things that I can do. So thank you for that. Solid hands, yeah. Thanks.
Yeah, thanks, Raul, for an incredibly important and timely presentation. And two things. One, can you provide some specific guidance? This great crowd is helpful to include in the medical records, because it sounds like documentation could be very key for people who are going up. The other thing is, if there's time, recognizing the incredible shortage of bilingual mental health providers. Do you have specific ideas or knowledge about resources in the Bay Area that perform or to do group visits, which could also be helpful?
Absolutely. Those are two really fantastic questions. I do want to tell folks to please go to the, oops, try this again. Please go to the Everyone Belongs Here webpage. There is a lot more information about documentation specifically. I will say here that as far as we know, medical records have never been subpoenaed for an immigration case. That doesn't mean it can't be done. So we still have to be vigilant. Goodness gracious, where did it go? There it is. So we still have to be vigilant, but as far as we know, it's never been subpoenaed. We also know that we have several layers, right, protecting healthcare information. But again, there theoretically, records could potentially be subpoenaed, and information in there can potentially be used against someone in their court case. In general, we never want to refer to any type of immigration status. We're not lawyers, right? We don't know what those statuses are. We don't know what the implications are. Most of us don't even know how to ask. Having any type of reference to legal, illegal, undocumented, documented, or anything like that, it's just really not necessary in our medical records, and we should stay away from any of that type of language. Sometimes what I will do is say that people have traveled from a particular place without actually saying anything about their immigration status. Or I might talk about stress about adjustment to a new move, right? Kids, even if they're moving from one house to a new house, are going to have some adjustment concerns. And that's true for people who migrate as well. And the other thing that I usually say is, if you're going to ask people about immigration status, make sure that it's intentional, right? If you're trying to help someone and you have the resources to do so, sure, open up that conversation and be transparent and say, I would like to ask you a little bit more about your concerns around immigration and how that affects your access to certain programs or support services that I would like to connect you with. Are there any concerns that you have about that, so I can better route you? The other option is that we do some cross-training with our social workers or case managers, right, to be able to have better handle of the resources that are out there, and they can have a much more trauma-informed, more relaxed interaction with someone who specializes in that and can do a better job of orienting people and connecting them with the right resources. So I think there's a lot of ways that you can think about that. It really just depends on what your practice looks like, what you feel that you're comfortable doing, and the expertise that you have around you. And if you lack that expertise, what are the ways in which we can do some capacity building, not only for physicians, but for everyone else on the healthcare team, and where it might feel appropriate. And then in terms of the mental health, I think we have a lot more exploration to do there. There are some folks who are really looking into different models of providing mental health services, psychological first aid, peer groups. A lot of our community-based organizations are doing these types of work. And so making relationships with the CBOs to be able to have a referral pathway, I think, is also important. People are also talking about community health workers who could be trained in facilitating some types of these support groups to kind of mitigate some of those things before we start getting to, clinical diagnoses of depression, anxiety, and PTSD and things like that. So I think there are a lot of, and I wish, my mental health colleagues were here thinking about like Will Martinez and folks like that who do a lot of this work.
Thank you for such a wonderful and timely presentation. Something that struck me that as individual providers might come up quite a bit more is the medical letter of necessity that you referenced. And I'm wondering, as a department, if we should try to build this into our APEX, much like we have a default letter for school excuses, work excuses, that we have one for this, so that the provider can just basically enter like the short medical description that's required, and that we've also some maybe agreed upon language by our department that's like what this letter should.
I love that suggestion, and I think it's a really great one. I have very little contact with the Epic system on this side, since I only work at the general. But if there is a champion who really wants to do that, feel free to email me, and we can get a group together and just make sure that we have those templates and have them in Epic and ready to go. It would be really wonderful to have particular specialists look at these things and make sure that it works for them, that it doesn't feel overwhelming or hard to do. We want to make this as easy as possible to not interrupt your workflow as well. But it would be wonderful to also have specialists to look at that and be like, does this make sense? Is this something that I can do? And figure out workflows to make that a possibility. I love that.
There's actually a request from the Zoom to go to your slide with the your own individual plan survey on the end, so maybe you can pull that back up again. And we're not going to spam everybody with the slides via email. That's like invite, but feel free to email us at once slides, and it's also recorded.
Yeah, you can also email me.
I just had a comment. My Marilyn Mackingham, one of the kidney transplant practitioners, and I think her was the one that had the story vignette that you had, and so as a group, because in order to list a patient, their immigrant status has, much of our team is better not experienced in talking to families about their immigration status and providing reassurance. The whole question about what to document and not, we've struggled with, because there's got to be a place that we can share as a team, so that if I'm seeing a patient, I know we need to get in touch with somebody else. We recently got some advice that I think was very helpful. When we need to document about the immigration status, that we add language about about why removal of patient or family member would be detrimental to that patient. But for instance, one of my patients, were they to be removed from this country, they wouldn't have access.
Yeah, I really think I appreciate that. And I really think it's a really intimate conversation to have with families. And sometimes when families come to you with this specific request, like all bets are off, like they might already have a deportation order, like it's not a secret. And so, I think needs to be some context in the way you're talking about that or thinking about that. I've also talked to other groups about thinking about an ICD-10 code, like some type of Z code, where you can kind of group families that are immigrant families and use some like very rare or only known to use Z code or something like that to be able to follow families. I think there are different ways to really think about how you case manage some of these families and how to strike up conversations with these families. But certainly if they come to you with that request, right, having that conversation, is it okay that I put this in your medical record? Are you comfortable with that? Are there things you don't want me to put in your medical record? And just really having that conversation, I think is important.
In terms of staying up to date with California's doing to protect our families, to look at all the media, like, is there a specific source website that you would recommend us being able to stay up to date?
If you want to talk, if we're talking about from the angle of medical care access and harms, everyone belongs here. We have a group of physicians, medical students who are going to keep that up to date on a regular basis, right? I mean, essentially, it's a coalition of us who are trying to put that together and keep it up to date as much as possible. The other thing that I recommend to people who really want to have their finger in the pulse, I know social media right now and the way we use social media is like, there's a lot of discussion around that, but I have my own kind of just like Dr. Raul account on Instagram, and I just follow a bunch of immigrant rights and justice groups. I follow ACLU, National Immigration Law Center, Immigration Legal Resource Center, Physicians for Human Rights, and a bunch of folks. And they are really great at keeping up to date with what's going on. And I also find tons of really helpful and important webinars that these folks host as well. That's just something that I do. It's helpful for me. It helps me keep my finger on the pulse and just kind of know what's going on.
And I think there's actually a question from the Zoom audience that is somewhat similar, but a slightly different focus. That Dr. Amy Thomas, she asked, will there be any changes to public charge based on the legal changes, or any new communication that we should be sharing with our patients to allow them to continue accessing resources without revealing their immigration status?
That's wonderful. We don't know yet. There's, as far as I know, who knows? Maybe I can go back to the news right now and like, oh, a new executive order was signed. I don't know. But as far as I know, at the moment, public charge remains the same. Again, the vast majority of people who are immigrants will not even fall under the public charge test. And this is really more about awareness. I would continue to use our case managers, social workers, eligibility workers to provide the most up-to-date and accurate information in terms of eligibility for these programs. And at the moment, from my understanding, the message is still to encourage folks to enroll in these programs. And the state of California has done a lot of information sharing around protecting the citizens of California.
There is one more.
No, I was gonna say, to that end, I heard on NPR, Raul, as I was walking in, that a judge in Washington State has blocked the birthright executive order for now.
Yeah,
So it's
great.
proceeding up. It's
There we go. Hot off the press.
Yeah.
Thanks.
NPR.
Yeah, and the New York Times this morning made it very clear it's totally unclear whether
Right.
any of these executive orders.
That's right.
Constitutional.
Right. Yeah. Which I think brings me to the closing point, right? It's just a lot of this is about fear and anxiety and terrorizing. And even that in and of itself has implications.
Right, well, with that, thank you so much. I'm sure we're gonna get you back within the next 4 years to get updates on this.
I'm happy to. Thank you all so much for coming.
How are you doing? Yeah. Training. Yeah. This is just like training work, right? Like you don't know when you're gonna show up and like. Great presentation.